Hi, I'm Nicole Durr. I'm the Dental Assistant Instructor here at Davis Technical College, and today we will be doing the composite fillings. Okay, so if you're finished with an amalgam filling on your patient, if you have any leftover amalgam in the amalgam well, then you're going to take it and you'll have make sure you have your mask on, okay? You'll open up this container and you're going to dump the excess amalgam into your container. And this, you can also put your capsules if you would like to put them in there. If you extracted a tooth that had amalgam in it, you can put the tooth in there that has the amalgam. So any piece of amalgam we'll put in there just to keep the mercury vapors in one location, okay? So if we are getting, whether you have a patient that is having both an amalgam and composite done, if you're doing that, I would just add, you have just a couple extra things for a composite on there. Or for here, when we're teaching, sometimes we're just doing the amalgam and then we're getting into the composite. So it's not too much of a change instrument-wise. I'm not really going to add too many instruments. So I'm actually going to trade places with these trays. So you're going to have, let's talk about what's on this tray first, and then we'll bring in whatever else we need from our amalgam tray. So first of all, we're going to have our curing light, and we have the barrier on there, okay, and you'll have your little shield of sorts, whichever kind you have in your office. Make sure you have a shield. And then you're going to have your etch. Okay, so that, always look for the little blue. Etch is a phosphoric acid. Okay, so we want to treat it like an acid. And we're going to get a tip on these in just a minute. So we have etch, bond, which can be, I pulled out a couple of them so you can see the differences. Bond can come in a syringe, it can come in a bottle, or it can come in a little capsule, which is, it's about this size, maybe just about double the size on that, but still fairly small capsule where you twist it and you would grab a micro brush and you'll actually dip it, because the capsule, when you twist it and break it open, it opens up to where you have a little area and you just dip in with a little micro brush. And so a micro brush, they can come in different sizes. You normally just take it and bend it so it has that little curve to it. And that just makes it easier to reach to the tooth, okay? Just like your instruments, how they have a little bend to them. So your bond can be in a little capsule, it can be in a bottle, syringe, or sometimes it will be in a packet. Like there's a little packet, and it kind of reminds me of, what are they called? The Capri Suns, the little packet that you poke the straw through. It's kind of that same idea, where it's a little rectangular pack and you'll puncture a hole with your micro brush and kind of stir it around, and it'll have just a little bit of bond in there, and you'll just stir it in. Your dentist may have you use a little dish if you're doing bond that's in the bottle, because you'll squeeze a couple drops of that into a tiny little dish. It's very, very small, smaller than the size of a dime on the opening of that little bowl, the little dish. And then you would have either your flowable composite, which it will say on here, always read this, because you have different syringes that look quite similar. Because this is bond, but I have a sealant that looks very close to this syringe. So you literally have to grab whatever it is and read what it says, because they vary with each brand. So this one says my flowable, and this says the shade is A2. So you would use a shade guide if you're doing anything on an anterior tooth, anything that we can see when the patient smiles, will match that shade of their tooth to the composite. So the shade might say A1, A2, A3, and it keeps going on all the shade colors. But let's say that our shade guide tells us A2. So I'd grab my flowable that has A2 on it, and A2 is kind of your natural looking tooth color. A1 is a little bit whiter on the tooth coloring. A3 would be a little more of a yellow coloring to it. So it can kind of vary, and then it goes, B's are like your bleached paper white teeth. So it just depends on what your patient's tooth color is. Now your flowable, this is used if you have just a really tiny occlusal filling that you're going to do, or if you have a deeper filling that's kind of covering a broad area of the tooth, you may put this down because it's liquid consistency, and that will just kind of fill in the bottom layer of the tooth. So the dentist may use that on a larger filling as well. So kind of depends on what the dentist wants. He may, if it's a larger filling, you're going to use a bulk composite, which is going to come in a little capsule like this. Again, you'll check the color. This one is A2 on here. And I'm going to have you just take that out and put it back in just so we can see how that happens. So this part we're going to pull back on and then place it in, pull back on that, let it go. Perfect. So that's ready to go for the dentist. You can set that down. You want to check how much is in it because this capsule is about halfway used. So by squeezing it, we test how much is left over in there. So that's important because if we are doing a very large tooth and we're doing an MOD composite, that's going to take up this plus another capsule, maybe even a third. So again, kind of like our amalgam, we want to approximate how much we need sitting on our tray so we're ready for it. Okay, so the way that I remember the steps of what goes where, instead of your ABCs, it's your EBCs, okay? So we have etch, bond, composite, EBC, okay? That's how I always try to think of funny little ways to help me remember the order. We're going to have, so I think we'll just use the syringe style bond today. So we're going to get the tips on these. Now your tips, it kind of depends on what material you're using. The tips can be a different diameter. Some can be really tiny, some can be a wider opening. So if you're doing your etch, it doesn't need a fine tip. It can have a wider opening to it. But if I'm doing sealant, I'm trying to get in the very small grooves of the tooth, and so I need a thinner amount. So I'm going to pick a smaller tip on the end to it. And then you need to also look at whether this is transparent. If you can kind of see through this, any material that cures with a light, so bond, composite, sealant, all of those are sensitive to your patient light. So if that's the case, you want to get one that is black or in whatever way that you can't see through it, because there are some tips where you can kind of see through it. If that's the case, don't use that because the material will get cured in the tip and it'll clog and you won't be able to use it. So in order to do these tips, you're just going to take the cap, you're going to twist this off, okay, twist that off, and then you would want to, this would be something that you do before your patient comes in the room, okay? This is all taken care of before they come. So I would put this in a cupboard, okay? We'll just pretend that's our cupboard for now. We're going to put that off to the side. We're going to put this on, and you just put it down and just twist, okay? So I'm going to have you do that with the next one. Let's do that with the bond. So bond, I'm actually going to use this cute little brush tip, okay? Because bond, you kind of paint it around on the tooth. So bond is like the glue for the tooth, basically. Your etch is a phosphoric acid, and it's going to kind of roughen the surface of the tooth, okay? If you've ever seen etched glass, it kind of looks frosty, and that's the same thing what will happen to a tooth that has been etched. It will no longer have a sheen to it. It will look dull, okay? And it kind of roughens the surface, opens up the microtubules of the tooth to allow the bond and the composite or sealant, whatever you're doing at that point, it allows it to stick, okay? And then let's do this tip for the flowable composite. Yeah, and I'll move these over here. But these, like I say, you'd put them in a cupboard just so they don't get contaminated with the stuff that kind of flies in the room that you can't really see, okay? So we have our etch, and so I'm going to have them in order. We're going to go etch, bond, composite, okay? And then with our instruments, we will have our mirror and explorer. You would have your anesthetic with whatever type of anesthetic your dentist wants. And you may or may not use the spoon excavator. We'll have some topical to do our anesthetic. You may or may not use Dical, okay, your calcium hydroxide with your base and your catalyst. I usually put floss on my tray, you'll always have floss on the tray if it's something that is mesial or distal of the tooth. If it has an MO or a DO or just a mesial or distal, you're always going to have floss. But if I'm doing just an occlusal, I still put floss on there just in case. Sometimes he'll floss something that wasn't even part of the treatment plan. So I just put it there just to cover my bases. So you'll have that. He may have you use a ball burnisher, but you'll mostly just have a composite placement instrument. This one would pretty much reduce the need for having that ball burnisher because this one has kind of a plugger end to it, and it has this paddle side. If it has that paddle type of end, that's for going around the tooth, and then this one's for kind of anything, the occlusal part of the tooth. And you would have your articulating paper pliers to check the height. Okay, so we'll just go through getting him numb. We're just going to do this same tooth up here just so we can see what's going on. So go ahead and we're going to do the same thing with that topical. Just like we did with the amalgam, you're going to dry off the area with your gauze first. There you go. Yep. And then you're going to place that topical. So right next to the tooth that we did the amalgam on. So just go right on the gums. Right. So it was this one right here. There you go. Yep. And then you'll keep that there until they're feeling numb. So like we said, about a minute or so. And then you'll also put it right back in that little pocket area. So if they have saliva, we're going to saliva eject. We're going to dry off the area and then place the topical. And we're going to have it in both of those areas. Check and see if it feels numb to them. Okay, and then we're going to wipe away the excess with that gauze. Okay, so now we're going to do the anesthetic. So I'm going to have you pass me the anesthetic and make sure that that is turned so I can get my thumb in there. Perfect. Okay, you'll put the cap in the little cap holder, and we're going to, typically he'll do this little pocket area first. Okay, so he'll go through, do that, and then he'll move to this area. If it's a child, again, we want to watch their hands. But if not, we're just going to get ready to rinse. So go ahead and rinse for me. And just rinse this area down here, just where we did the anesthetic. It'll take a minute for the water to kick in. We ran out of water, so we had to refill it, huh? So it takes just a second for it to come through the tube. Good. All right, and just a reminder, I'm going to have my mask up and down just so I can talk to you, but in real scenario, it will be up the whole time. Okay, so we're going to pretend the time has elapsed that they have become numb. So let's say 10 minutes has gone by. If it was one of these anterior teeth that we just did an infiltration injection, you would just check if they're numb right after and go, all right, we're ready to go. We'll just start prepping. But with this one, we'll let it sit. Okay, so you're going to pass me the Mirror and Explorer. Perfect. So keep that. We're going to have it about in this area when you're passing it to me. And so we're just going to check and make sure that they're numb. And then I'm going to hang on to this and I'm going to pass that back to you. And we're going to get ready to prep. So get your HVE and air water syringe. You're going to have, again, you're going to have a 330 pair on your high speed. Your slow speed is going to have your round burr with like a number 4 round. But the dentist will have a variety of burrs that he'll kind of switch through. But I'm just going to be using these two just for prepping purposes. Okay, so you're going to get in there first, get your HVE turned on, and you want to be up close to that tooth that we're working on. Okay, rinse and dry that. Good. All right, now since we're only doing an occlusal filling, I'm purposely leaving that mesial part of that amalgam. You're going to keep those though, because we're going to prep out with the slow speed now. But if you were normally prepping this out, you would have matrix bands and things like that, but we're not to that point yet. That's for clinical 4. Right now we're just doing a simple occlusal. So we're going to do the round burr, which again is kind of bumpy for your patient. You want to make sure that the tooth is rinsed really well and dried really well. Okay, rinse and dry. Good. Okay. So you're going to set those down. All right. Now again, if you had a patient that used a dental dam, you would have placed that right after numbing the patient. Once they're feeling numb, we'd place a dental dam. It's just kind of tricky for him to hold a dental dam in place, but that would be your most ideal scenario. If you're not using a dental dam, this would be the time that you would isolate the tooth. So we're going to isolate both sides of the teeth to keep the tongue out of the way and keep the cheek out of the way. Because if we are doing a composite, that's the difference between an amalgam and a composite. An amalgam, it's okay if it gets wet. A composite, any little bit of moisture, whether it's water or saliva, it's not going to stick. Okay, so we need to isolate it, whether we're doing a dental dam, which is your best option. You can use the triangle in a cotton roll. You could use an isolite, which is something that's going to suction and kind of light the area. That's totally fine too. As long as we keep it dry, that's our main goal, okay? With our triangle and cotton rolls, when we're isolating the tooth for a composite, you could use a triangle. And so this one is a size small, so it has a little S embossed on here. Some of them may have a little shiny silver side on one end. And so let's say the shiny side would be right here and the other side would be just cotton. So if that's the case, the shiny side will, so let's say this one's our shiny side, that will go toward the lingual part of the tooth. So the cotton side will go against their cheek. So you'd pull their cheek out and place it in here. With the different sizes of triangle, this one's a small, you could have a medium, large. What I typically like to do is I bend it to give it a curve shape. And that just helps it fit in their mouth. It doesn't feel like it's a big piece of cardboard sitting in their cheek. So we'll place that in there. That is for, you can use it for the top or the bottom, depending on the size of your triangle. He would need a larger size. This is for children, so we would want to have a larger size for this mouth. But we'd place that in there, make sure the cheek is pulled all the way out, and then put it in. And then your triangle, or your cotton roll, you'd have the patient lift their tongue, and you just kind of slide this under their tongue. Make sure the entire thing is tucked under their tongue, on both the tip of their tongue and toward the back of their throat. So that would be to isolate something on the bottom of their mouth. If you're doing something on the top, you just need the triangle, and that's it. As long as we keep it dry, that's our main goal, okay? So we are going to, we've had the tooth prepped, and then we're going to do our etch. That's our first step, okay? So you're going to get the etch, and you're going to pass it to me. Now, where would the dentist hold on to that syringe to squirt it? Yeah, so you're going to hold right there. Perfect. So as you're passing, and one thing what I do when I pass it, what does this look like in a way? It looks like a needle, yeah. So if you have a patient with a big fear of needles and they see this, they're going to, oh, what's that? Okay, so if that's the case, what I do, if I know that I have a patient that's nervous, before we start with all of this, I go through and show them. I'm like, this is just, and I kind of poke it on my gloves so they see it's okay. It's nothing you need to worry about. I don't say hurt, shot, blood, any of those words though. I just say, this is just going to squirt. It's nothing to worry about, okay? And if they still don't believe me, I can take and squirt some on a gauze or something so they see that's what it's for. But I want to get rid of any of those anxieties before we get to this point. So as I'm passing it though, I normally hold it, so if anything drips, it's going to drip on my glove. Because this, as I mentioned before, this is phosphoric acid. If this were to drip on your patient, it will burn the skin, okay? So if it does drip, you want to get, you can grab a dry gauze and wipe it up, but I'd grab a wet gauze after that and make sure to wipe it thoroughly so they don't have any of that etch on their skin, okay? Right, so we are going to place our etch. So we're going to squirt that in the tooth, and it's just going to be kind of filled in with a little bubble of etch. Now you see there's some etch on the tip, so when he passes this back to you, be careful when you grab it. And I normally set it down on a gauze, so as it kind of leaks out, it's not going to get on my tray and get on my other instruments, okay? So your etch is going to sit there for about 20 seconds or so, okay? Depends on the product that you have, but that's the general rule for etch, is it sits there for 20 seconds, okay? So we're going to let it sit. As the 20 seconds finish up, what I'm going to have you do is I'm going to have you suction over the tooth. And this is very quick. It's going to sound like a lot of steps, but it's all kind of in the same motion. You're going to suction over the top of the tooth, and then you're going to move your HVE to the side of the tooth. You're going to do water, and then you're going to switch to doing air and water. The reason why that's important is it's to prevent the etch from splashing everywhere. We don't want that acid getting on patient, you, doctor, so we want to make sure that that's taken care of. All right, so we've had our 20 seconds has elapsed, so you're going to get your HVE and air water, and you're going to, I'm going to kind of hold this gauze just to make sure it's safe, but you're just going to go right over top of it, and you're going to go bump, and then you're going to go off to the side, and then you're going to do water, and then air and water, and then dry. And just get a little closer so we can dry that tooth, get it perfectly dried up. Good. Okay, so set those down. All right, so we're going to leave that there. Now we're ready for the bond. So if you had this bottle type, if you don't have the little dish, then what you do this over your tray. You just do a drop, okay? And sometimes the bottle is a little difficult to squeeze, but just squeeze out one drop. Make sure it doesn't touch the tip of this, because this will become contaminated from touching the tooth. So always keep it away from it. Bond evaporates quickly, so don't get this ready until you need it. I only get the bond ready when I'm waiting for the etch to sit, okay? Because if I do it any sooner, it's just gonna evaporate off. It's kind of like alcohol. It will evaporate fairly quickly, okay? But we're just gonna use our little syringe just to make it a little easier. So bond, like I mentioned before, is like the glue for the tooth. So I'm just gonna, see some of that coming out. Bond has a fairly strong smell. It kind of smells like nail polish in a way. Not entirely, but kind of that same idea. Now bond is something that you are going to light cure. All right, so, and this came out of the tip quite quickly, a little more than what I figured it would. So I'm just going to use, grab that gauze for me actually. I'm just going to get some of that bond out. So we just need a thin layer. We don't need too much bond. Okay, and then you're going to set those down. So what you're going to do, you're going to grab your air water syringe, not your HVE, just that. Yep, we're just going to use some air. We're going to blow air into the tooth. But before we do that, we've had water in the lines. So you're going to blow air away from you and your patient. Just push the air button. Good. That's going to make sure that there's no water left over in the lines. And then you're going to blow on the tooth with just the air. Good. That's perfect. So like 3 seconds or so. And that's going to thin and dry the bond. Now we're going to light cure. So with your curing light, it's not going to take too much time for bond to cure, because it is a thin layer and we've already kind of blown some of it. And so you're going to get this, it depends on your curing light. This one has a start and stop button, so we push this to turn it on, and then we'll push it again to actually have the light going, okay? Now this is bright like looking at the sun, so that's where you'd want to have your shield, and we'll do this extra just so we're covering our bases with everything. So either you or the dentist, it depends, you're going to put that right above the tooth, and then is that covering you too? Okay, sorry, trying to make sure that we're all getting all the angles covered. And then it's going to do a couple beeps, and then it's finished. Okay, it goes beep, beep, beep on this one, and then it's done. Okay, it depends on the curing light though. Others will have different methods of beeping. Okay, so you're going to set that down. And now we are ready for the composite. Now with your composite, this kind of composite is sensitive to our patient light. So if that's the case, and when you're checking colors, you would have checked this before this point, okay? You would have had natural lighting, so you would have turned your light off. You would have had a shade guide, check the color that you wanted for the patient, and this would be something that the dentist typically will do. But check the color, make sure you have what you like, and then we'll do that composite. But we've already just chosen our A2, so we're ready to go on that. But just know this is sensitive to light. So depending on your light, this has high, medium, and low. So we're on low now. So when we're doing just flowable or our bulk composite, either one of these, it's probably best just to get in the habit of switching it over to low at this point, okay? So first I'm going to have you pass me the flowable composite. I'm going to do a little bit of each just so you can see what happens with both of them. So grab the flowable composite, and I'm just going to put a little bit in there. Now anytime he has something with a syringe, he's more than likely going to want the micro brush, and I set it, okay, there we go. So bring that micro brush and grab a gauze too, just to clean off that micro brush. And I'm just going to test this because it feels like it's not wanting to come out, and that always makes me nervous. Because sometimes it can clog. Okay, there we go, it's coming. All right. So we're going to place this in that tooth. And so sometimes they'll put a little bit of flowable right down in the base of the tooth. And so you'll have that pinky out, yep, and then you'll get that to me. And so he may or may not use this. So you just always want to have it. But just plan that directly after he places this, he'll want to cure. Okay, so you're going to grab the curing light again. And this depends on the dentist. He may cure or you may cure. It just depends. So you're just going to put that right over the tooth again. Push it one more time. There you go. Okay, so you want to kind of hover right over the tooth to where you're almost touching it. Okay? Because if you're laying right down on top of it, especially if you have something, okay, it's off. Especially if you have something that is right at the occlusal, you don't want to lay directly on it at that point because it's going to stick all over your curing light. But if you've cured the top layer, you can lay it down on there if you need to once that top layer is hardened, okay? So now we're going to do the bulk composite. You're going to pass that to me and you're going to hold on to the end, yep, right there. So with this, if he was doing a tooth on top, you could take this and turn it so his hand can stay straight. You don't have to, but it's just a nice little thing so he's not going like this, okay? But since we're on the one on the bottom, you're going to pull that tip off. And if you've already used this, like this one had already been used, so what you'd want to do is you'd want to squish a little bit of it out and get that off, okay? We want a fresh tip, okay? So we'll get rid of that, and it's wanting to stick on my glove instead. There we go. Now with this, we're going to use our composite instrument or a ball burnisher. It depends on what you have in your office. But we'll just use the plugger end of the composite placement instrument because I'm doing an occlusal. So we're just going to get this composite in there. Okay, and since this is bigger, this is something you can't really grab with your pinky. So you're going to bring these 3 fingers out, and then you can grab it, okay? Now you're going to get the micro brush, a gauze, and later we'll be ready to cure. But just for now, we'll just stick with the micro brush and gauze because I'm going to be picking away any excess pieces. Your micro brush is going to act kind of like a little broom to sweep away any little crumbs. Because if we have any crumbs that haven't been, if we leave any crumbs, once we cure them, they turn into sharp little pieces. And so we don't want that for our patient. These little pieces, the dentist might call them flash. That's what they refer to those little crumbs as. This doesn't really like to stain these mannequin teeth very well. So, trying to get it to stay in there. Each time I try to pull some of it off, it feels like I'm taking the rest of the filling with it. Typically with an amalgam, you need, this one is specific to, sorry, I said amalgam, didn't I? With a composite, you will use, this instrument is tailored for composite. Sometimes if you have something that's more metal, it could potentially scratch, leave gray marks on the tooth. If you're doing an occlusal, I don't see it being a problem. But if you're doing something on the facial part of the tooth, you would use a little plastic strip. It's a little clear plastic strip that you can put over top of the tooth, and you can rub the instrument over top of it, and that will prevent any gray markings from happening. But for this one, we're okay with this instrument because this one is specifically for composite. Okay, and so I'm going to pass that to you, and I'm going to grab a little micro brush, and you're just going to stay there with that gauze, and we're just going to get this flash. Make sure that nothing's there. Now, here's the thing. This depends on you and your dentist. You would want to wait until he values your opinion, that he knows that you know what you're doing. And but some dentists, they will appreciate if you mention that there's some flash, okay? I wait until it looks like he's ready to cure though. I let him do his thing, and then if I can see a piece that I'm like, I don't know if he can see that, because you're at a different angle than what I am, so you may see something that I don't. But if there's a little spot, and like I say, you just have to check with your dentist on this, but mine, he was okay if I'd say there's a little bit of flash on the lingual, and I'm not trying to say it in a way of like, boy, you're missing that. I'm just trying to help him, because it's easier to get it while it's soft before we cure it, okay? But other dentists may feel like you're stepping on their toes, so you want to check with them on that and see if they would want you to point that out or not. Okay, so once we get that out, then you're going to set that down and we're going to cure it. Now this, we have the bulk composite, so it's going to take longer. You want to treat it kind of like an apple pie or something. When you put it in the oven, you're cooking it, and which is essentially what our curing light's doing. It's hardening it, but maybe you didn't have it in there very long. The crust is cooked, but the apples are not cooked all the way. Same concept with your composite. We want to have the curing light on there, keep it on there for a longer period of time, and if it's a larger tooth or more area that we've covered, you may want to take different angles on the tooth. You'd go on the occlusal, maybe go on the buccal and the lingual, try to get different angles so we're cooking all of it equally, okay? This one's not going to take too long. I'm still going to have you do 2 cures just to make sure, because it is a little deeper in there. So go ahead, get that curing light out, and we're going to get that curing. We're going to do it twice. Yep, just let it sit there. Wait for those 3 beeps to let you know that it's done. And then I would lay it right on the tooth since we did our first curing, because we want to be pretty close. If we're too far away, it won't do it, okay? And so cure one more time. Good. Okay, so you're going to pass me the Explorer, so I want to check and see if it's cured all the way and if there's any problems. You're going to turn the light back to, I just do medium on these ones because it's bright enough, but we're going to check and make sure that everything's good. Okay, and it feels like it is. So now we're going to do the articulating paper. But first, hold on, we have all the stuff that he was isolated with. So let's do that. So you're going to get some water, and we're going to get this wet. Okay, so just get the corner of that wet. And then once you get it right there, then what you'll do, I'm going to snag this from you for just a second. Once you get that little edge, then you're going to keep water and go back and forth with the water, back and forth down their cheek as you peel this away, because that's the part that's going to be stuck, okay? And so you'll peel that away, and then you would rinse and dry their mouth out, because sometimes the dry angle will leave little balls of cotton in their mouth. So go ahead and give them a rinse real quick, just this area. And we're going to dry this section of teeth. Good. Dry. Perfect. So get the occlusal part, because we're going to do the articulating paper pliers. So you can set that down. Now, the dentist, he could do, polishing. So he could use different discs to smooth this out. It will just kind of polish and wear down as the patient chews and things. But if the dentist wants to make sure that everything is nice and smooth and comfortable for the patient, he could have different polishing discs. Okay, so you may or may not polish, depends on the dentist. You'll rinse if you did polish, give them another rinse, and then we're going to check their bite, okay? So we would have taken the dry angle out and the cotton roll, but they don't really stay, so we didn't have the cotton roll to take out. We're going to have him bite. Again, we're looking for, and he doesn't chew, so we're just going to tap on here. We're going to look. So there's just a little bit of a blue spot. Can you see that right on the occlusal right there? So what we do is you're going to get your HVE, and I'm just going to burr that little tiny area down. After we burr it down, then you're just going to rinse and dry, and then we're going to check one more time with the articulating paper. Okay. Rinse and dry. Good. Just that tooth, and then you'll just dry the whole section. Okay, so set those down, and then you'll grab the articulating paper one more time. A lot of back and forth for the assistant at this part. And so you want to be very involved when you're looking so you know whether or not it got all of it. So, oh, I kind of swiped some of it. But I didn't see any that time. I normally just kind of wipe some of it away. And you could grab a gauze, but since it's a mannequin, it wipes a little better with my glove. But we would just keep that process going until we get all the blue marking off the filling, okay? If it's on the tooth itself, that's fine. We just want the filling. And then we'll have the patient bite down and just see how everything feels. See if anything feels high, feels funny to them, because if it is, it will kind of affect their bite. It can kind of bruise the opposing teeth if it feels off, especially for an adult, because your bite is in a set area. Okay, so we would just rinse their mouth, and we will tell them their post-op instructions. So he's going to be numb for a couple hours, Tylenol or ibuprofen. So it's basically the same thing that you'll tell for most things. I usually say those same parts, and then I tailor it to what procedure they had done that day. So Tylenol or Motrin, and you're numb on your bottom right side. Half your cheek and tongue are going to be numb. This is a composite, so this is the tooth-colored filling, and it's hard. It's at its full strength once the curing light hits it. So, but it still can pop out. Like I say, I've seen one pop out before where he's like, okay, chew down, bite down on it, come on, you're not going to hurt it. And she's a very competitive person, and she bit hard, and it popped it out. And so we had to redo the whole filling again. Mm-hmm. So it is possible, but for most cases, we're okay. It's good. And they're fine to eat on it as long as the numbness is gone, okay? And then again, just staying away from super, super sticky items that are going to pull at their mouth for longevity purposes, okay? We just don't want to pull that filling out of their mouth. And then again, sensitivity, that can still happen. With an amalgam or a composite, you're still prone to sensitivity. And so just give it about a week or two. If it's still significant after 2 weeks, have them call and we'll check on that, okay? And it's important if there's anything in between the teeth, if we did an MO, we want to make sure that we can floss clearly in between those teeth. Whether it's amalgam or composite, the floss should come up not shredded at all, okay? It should come up nicely, because sometimes a piece of composite, that little piece of flash can be there. So if you cured this and there's a piece of flash on there, you'll pass him like maybe a spoon excavator or a discoid and cleoid, something that you can just kind of pop that off. If it doesn't easily just pop off, then you'll use your burr to burr it down, okay? So that's pretty much it. After we've checked their bite and polished it if it needs polishing, we'll give them their post-op instructions, and then they're finished. So that completes our composite filling.